Norma, could you welcome people?
Yes, hold on. Okay, good morning, everyone, or good afternoon, or good night, wherever you are. My name is Norma Samuel, and I'm the Florida Friendly Landscaping and Urban Horticulture Agent with the University of Florida IFAS Extension. And I am also the president of the board for the Global Forum for Rural Advisory Services, GFRAS. So we put together this series on mental health in agriculture because of the concerns that we raised at the last GFRAS annual meeting. And so we have experts from the University of Florida that have willingly volunteered their time to lend their expertise to conduct these webinars for us. Sorry, some of you weren't able to join us last week. However, we did send out the recording, and hopefully you have had time to view the recording, and we will try and answer any questions you have from that recording and also from today's session. Our speakers for today are Dr. Heidi Radunovich, and she's an associate professor and extension specialist in the Department of Family and Consumer Sciences at the University of Florida. She's also the program director for UF-IFAS Extension Engagement. Her teaching, research, and extension activities are related to rural and farmer health and mental health, disaster stress, and military families. Previously, she served as a faculty member at the National Rural Behavioral Health Center at the University of Florida, where she focused on child and family mental health, school-based prevention and intervention, teen risk behaviors, and disaster stress. Dr. Radunovich completed her undergraduate degree at Washington University, majoring in psychology and Spanish. Her master's and PhD in clinical psychology were earned at the University of South Florida, where she specialized in child and family therapy. And she is a licensed psychologist in the state of Florida. Our second presenter today is Terasa Younker, and she's a research associate and grant coordinator in the Department of Family, Youth, and Community Sciences at the University of Florida. She has a master's in sociology from Harvard University and is an instructor in mental health education for the National Alliance for Mental Illness. So thank you, ladies, for your time, and we look forward to hearing from you today. So I turn it over to you.
Thank you so much, Norma. And I just want to thank all of you for inviting us to come and speak. And thank you for attending. I'm sure for many of you, this is not the most convenient time to be getting on. I can see from the Q&A that there was someone who mentioned that they did not receive the link for the recording. So we may want to try to resend those later today, or perhaps when this one comes out, to send them both out to folks. I just want to say a big thank you to the USDA NIFA. Part of this work has been funded by the USDA NIFA from the Southern Region Farm and Ranch Stress Assistance Network, with AgriSafe as the lead agency. It has also been sponsored by UF-IFAS Extension. So I will go ahead and get started. So today we're going to talk a little bit about stress and access to care, as well as policies and interventions. And we'll try to have some time at the end for you guys to ask questions. We'll try to address questions throughout as they come up. Sometimes we have to wait a little bit before we can get in touch. Okay, so we'll start out talking about stress and increasing care. But before we begin, I just want to do a little bit of a review from the last time for those of you who maybe were not able to attend, or even for those who were, and you may not remember what we were talking about last time. Last time, what we covered was some general information about understanding mental health and mental health versus mental illness. and how we come up with diagnoses and the diagnostic categories. We went through some of the major ones, as well as the major classification systems that we're using and how they're different. And those are kind of different internationally as well. We talked a little bit about the impact of COVID-19 for this population. And we also talked about the different stressors that are facing farmers and affecting their mental health. All right, so I will start out talking a little bit about stress. As we talked about last time, farmers have some unique stressors. They face all the same stressors that everybody else does, right? And we all face a lot of stressors in our daily lives, but there are some specific stressors. What we know about stressors is that they contribute to the health side of things. So they can kind of lessen our health, and they can also contribute and make us more likely to experience mental illness. So it's really important to do what we can to manage our stress well. So we'll talk a bit about that first. So when we think about what is a stressor is basically anything that causes you to have a physical stress response. And the stress response is very much physical in nature. I do want to point out that stressors really vary from person to person. It's very unique. So what causes stress for me may not cause stress for you. And one of the examples that I give for this is that I'm the sort of person, when I am driving on the highway, I get anxious. It makes me really anxious, but there are lots of people out there, when they drive on the road, it's actually relaxing for them. They find it very soothing. So I will, so just keep in mind when you think about what is stressful, a lot of times we think about, well, what is stressful for me? And just keep in mind that what is stressful for you, it might feel different for other people, or things that aren't stressful for you may cause stress for others. So this is a very unique sort of thing, and we need to kind of keep in mind that everybody's a little different. So there are some common everyday stressors that we all just have to deal with. It's just part of life. And for those folks who live in more urban areas, this could include things like traffic or crowds or, a long commute time, whatever it is. We have to deal with a lot of things that are just sort of our everyday, typical, we sort of expected types of stressors. But then there are also additional stressors that we face that are more personal. It may have to do with things going on with our family or our health or our financial situation. And then there are major life events. So this could be things like moving or divorce, things like that. And, no matter what the stressors, we are still going to be having some sort of a physiological reaction. When we have the stress response, it is a very physical reaction. And what goes on is that the brain secretes adrenaline and cortisol, and those are sort of the hallmarks of being under stress. And this is what a lot of people refer to as the fight or flight response. And it definitely leads to some very big changes in your body, both in the short term and if it goes on for a long period of time for the long term. We know in the short term, it increases your heart rate, your breathing, gets faster, your blood pressure goes up. In order to get some quick energy to do that fight or flight, you're going to have sugars and fats enter your blood system quickly. And anything that can go on hold in your body goes on hold. So those sort of long-term projects in your body. So this would include things like reproduction. It would include things like growth. All those things sort of go by the wayside so that your body can really focus on this fight or flight. Your thinking can get temporarily very sharp. Your senses can get very sharp. This tends to be very short-term in nature. And if it goes on for a long period of time, oftentimes our brain gets very fuzzy. But at least initially, for that fight or flight, our body can get this very much of a sensation of everything kind of coming into focus, which is great. Our pupils dilate, our muscles tense, we perspire, and there are chemicals that are released to clot blood quickly. And so you could see where If you're having to face a bear and you may need to fight the bear or flee from the bear, this is all very advantageous. If you're worried about how you're going to manage your farm, and this is a long-term stressor, this is not very advantageous, right? This is just something that is going to be not necessarily so helpful in either the short term or the long term. But our body responds with fight or flight regardless of the type of stressor that we are experiencing, right? So even if we're not having to decide about whether to fight or flee from a bear, we are still having this bodily reaction. And our bodies are really made for us to have this reaction for the short term, but unfortunately, so many of the stressors that we are facing are much more long-term in nature. And when we have stress, large quantities of stress for a very long period of time, it can cause some physical damage to our bodies. What we find is that it affects our cardiovascular system. So your heart, your veins can all be affected. It can affect your gastrointestinal system, and people are more likely to get things like ulcerative colitis or ulcers related to having large amounts of stress. There's increased risk of diabetes. Particularly, they have found some evidence, and they're still sort of getting some research on this, that they have noticed that there has been an increase in the amount of type 1 diabetes, which oftentimes has been associated with childhood. But what they have been finding is for people under large amounts of stress, they're seeing an increased risk of developing type 1 diabetes later in life. So people in their 30s, their 40s, even their 50s, developing type 1 diabetes. And they're trying to figure out why. There's still, the jury's still out, but there has been some evidence that it's potentially contributes to an increased risk of diabetes type 1, also diabetes type 2, which is more weight related. There is a reduction in muscles because if you've got those bodily projects going on hold, you could see where, you may be burning that muscle in order to get that quick energy for long periods of time. It can reduce your muscles. In the short term, some people are able to get a large amount of sleep when they're under stress. That is their stress reaction. For a lot of folks, though, they have difficulty sleeping and their brains are sort of kind of going in a loop and thinking about their worries. And so they can have a lot of difficulty with sleep. But even beyond just the sleep deprivation, people can have some problems with memory and thinking when they've got a lot of stressors, particularly in the long term. Like I said, in the short term, things can kind of get into focus. People experience fatigue. And even though there's an initial, very brief burst in your immunity with fight or flight response, very quickly people become immunocompromised when they're under stress for long periods of time. And so you're going to be more vulnerable to things such as getting sick. Even things like cancer, there's a greater risk when your immune system is a bit more compromised due to stress. And what people find is if they're under stress for very long periods of time, when your stressor goes away, you're still feeling very keyed up and stressed. And it can be very hard to sort of what we would say unstress after you have been stressed out for a very long period of time. So these are some of the things that go on with your body. So for many years, the research on stress really was focused on men. For many years, a lot of the research that we did, especially related to health issues, was very much focused on men. It was only maybe about 30 years ago or so that they started to realize that there might be differences between how men and women respond physically. I guess the assumption was just like, well, everybody's the same, right? And then they started finding that women had different symptoms related to heart attack. And I think that sort of opened people's eyes to the fact that, gee, maybe we should be including women in studies. So once they started doing that, there were all kinds of things that they started finding that women were a little bit different. So in addition to the fight or flight response, which everyone has, they found that women were more likely to have an additional response that has been termed tend and befriend. And, not all women experience this with stress. There are actually some men who experience this, but it's definitely much more likely to be women. And in this response, you have oxytocin, which many people are familiar with in its role related to childbirth, right? So this is what women secrete when they're going through childbirth, and it helps them bond with their babies, and it's related to love and bonding. And then endogenous opioid peptides, which people really associate with that runner's high. And so that sort of happy feeling. And with this response, when you hear tend and befriend, it's pretty much what it sounds like. So when women are under stress, they are more likely to want to seek out social support and to take care of others. And when you think about historically, this is quite adaptive for women, because a lot of times they probably needed that social support to get through some difficult times. And because women were more likely to have child-rearing responsibilities, the fact that they would have an urge not to drop their children and run when that bear came, but to take care of their child is probably very adaptive. So this is something that is an additional stress response that we see a lot of times with women. I also just want to address, sometimes people feel really guilty because they get stressed easily. And some people just are more predisposed to being stressed. And there can be some physiological reasons for this, some genetic predispositions that people have, or some experiences that you have during childhood that make you more predisposed to be reactive to stress. So there's some biological things that are going on, but also there's some environmental things that go on related to this. So I would say, if you come from a family where your family members didn't handle stress well, if they were very reactive, that's how we learn how to deal with stress, is from our families growing up. So if you saw really good models of dealing with stress, that's what you learn. If you saw models growing up of people who got really, easily angry, or, got very upset very easily related to stress, this is kind of how you learn to cope. So some people, they get the double whammy of coming from the genetics where they're more predisposed to stress, as well as seeing family members who are more reactive to stress. So that makes it a lot harder to deal well with stress. So it's not to say that you can't change, though. Even if you have the biology, even if you have the history of seeing this in your environment growing up, you can still work on this, and you can still learn some better ways to cope with stress. So not all is lost, but just be kind to yourself and be more understanding and not feel like it's your fault. I would also say that some people, frankly, just have more stressors in their lives. They live in more stressful environments, or they face more stressors for a variety of reasons, such as poverty or dealing with racism, which add a lot of stress to people's lives. So some people just have more stress in their lives. But I tell you all this just so you don't feel as though there's something wrong with you or you're lesser than if you have difficulty dealing with stress. So although we really oftentimes can't change the stressors that we're experiencing, it's not something that we can really change or make go away. What we can do is change how we respond to those stressors. We can actively work on that. And the strategies that we use really kind of depend on us. As we talked about, stressors themselves can be very individual. And what can help us in dealing with stressors can also be very individual. And some of this really has to deal with who we are and our personality is. I think the general rules of thumb in dealing with stress and how to manage it properly is to start out by trying to control what we can. So coming up with a plan and trying to take control over what we can within our environment will help give us that that sense of control over things and helps us to feel better. Once we know, okay, if I do this, this, and this will help me with my problem, can help people feel better. Sometimes there are some things that we can do to sort of shift and change our environmental stressors. For example, I noticed that I would get very stressed in traffic. So I started finding alternate routes. It made me feel less stressed out when I had to do my commute. There are a lot of things though that we cannot change. So then we need to, the second part is really work on some stress reduction techniques and then self-care, just general self-care. And I'll talk a little bit about some of those. If you think about it, we are going to be having a lot of our immune system being compromised. So this is something that we need to make sure that we're taking good care of ourselves. Okay, I saw a hand raised. Teresa, do you think you could, or I don't know who can allow access to people to speak? Someone had their hand raised. Is there anyone can help with that? To ask a question.
I think all rights are with Norma right now.
Okay.
I'm trying to figure it out.
Okay. And Teresa, can you see if there are any questions? I see a few things in the Q&A. Maybe I'll just pause here and see if we can address some of the things that have come up so far.
Yes, I think most of the Q&A are comments. There is a question in the chat though that's in Spanish, so I'll let you take that one, Heidi. So, if you can see it.
Okay. Okay.
I'm not seeing the raised hand on my end, and I've been through the entire attendee list.
Okay. Okay. All right. Well, I will continue on then. All right. Okay. One thing that we need to kind of consider is the role that our thinking plays in the amount of stress that we experience. How we think, how we behave, and how we feel are very much interrelated. All these things have a real impact on one another. And what we can do is we can consciously change one of these, and it has an impact on the others. So we can consciously think differently about our situation, and that will help us to feel less stress or improve our mood. And when I think about, sort of changing our thoughts, one of the things that we notice a lot of times with stress is that people tend to engage in what I would call awfulizing, right? They start here, and then it's like, this leads to something negative, which leads to more negative. And suddenly we're going down this really negative cascade of thoughts and get to a very dark place very quickly. Sometimes we need to sort of catch ourselves when we're going down those negative paths and kind of really think about, okay, can I think about this in a different way that's a little bit more positive? And not to say that we would negate any, potential negative things going on, but sometimes we worry about things and kind of immediately go to the worst case scenario. So another way to think about this is to sort of reframe what we're going through as something a little bit more positive. I know here at the university, we get a lot of students who get very stressed about their exams. And when you have that sort of adrenaline and the cortisol going, it's very easy to feel very stressed. And then you have those physiological reactions and you interpret it as stress. One thing that I tell the students is to really think about this as being excited. Like, I'm excited, this is exciting. And when you think about it in those terms, it really changes how you feel about it. Also to sort of think about, well, what is the worst case scenario? What is the worst thing that can possibly happen here? And when you think about things, can you deal with the worst case scenario? Sometimes you can, sometimes you can't, but how can you deal with them? And sort of going through some of those, what are those plan Bs that we can come up with? And again, having those plans can make us feel a lot better. We can also directly impact our mood, which can change our thinking as well. One example that I give of this is music, and music can be very powerful in shaping how we feel about things. I would say a lot of times we're really not conscious even about the role that music can play in how we're feeling. And so listening to music can soothe us. It can also make us excited or happy, but it can also bring us down. And so we need to be really cautious about the music that we listen to, because it can be very powerful. And once we start shifting our mood through music, it affects the sort of thoughts that become easily accessible to us. Another way to more directly affect our mood is through humor. And when you are laughing or partaking in humor, it also shifts how you feel and how you think. And it can be really, it can be harder to access some of those negative thoughts that make us feel bad when we are watching something funny. So if there's any way to try to use humor, that can really shift your mood as well. And there are also some behaviors that we can engage in that have an impact on our thoughts and moods. And one of those that I recommend is exercise. When we exercise, that really sets off some really excellent neurochemicals that make us feel better. And it's healthy for you. And if you think about it, when you're under stress and your body is expecting to fight or flee, you get on a treadmill, you're basically engaging in that fleeing, aren't you? So when you're done, your body can kind of relax because you've done your fleeing. So those are some of the things that I recommend to people to consider as you're trying to deal with your own stressors. So here are some other ways to manage your stress and to engage in some self-care. One of the things that has been, and this is probably going to be particularly relevant for people who are in rural areas or on farms, is the spending time in nature. There has been a lot of research in the last decade or so on the impact of being out in nature and how it sort of refreshes you. And they're still trying to understand the mechanisms by which this works. But they have, especially being amongst trees, has been shown to show a reduction in stress and in improving mood, and spending time with animals. And so there has been a lot of work that has been done related to animal therapy. And so that spending time with therapeutic dogs or horses. So those are some things to sort of consider in dealing with stressors. We already talked about humor and exercise as being really important in dealing with things, music. For people who are spiritual in nature, praying can be very beneficial, or just, trying to give your problems over to a higher power can be really beneficial for some people. We talked about managing your thoughts. Engaging in distraction can be a great mechanism for people. So if you have some hobbies that really sort of engage you, can really help take your mind off of things, whatever those are. I know some people take up knitting just as a way to sort of get your mind off things. Using heat can be very beneficial because it can help relax those muscles that tense up when you're under stress. And once you release those muscles, it can give your brain the message that you're feeling better, that you're not as stressed. So this can be from something like a hot shower or a hot bath. It could also be even a heating pad to relax those muscles. Getting your social support can be very helpful, especially for women are more likely to want to seek out this, social support. It can be very beneficial. But I'll also say that sometimes people need a bit of time to themselves. And I know, especially during this pandemic, it's not always possible for people to get even just a little bit of time to themselves where they can just sort of shut the world out and just sort of self-focus. I would say that when you're under a lot of stress, sometimes people will resort to using substances. And when I say substances, this could be things like that are legal, like tobacco or alcohol, to take care of their stress. That can be very beneficial, or they may find it to be very beneficial, but it's also not necessarily always the healthiest reaction. And so you need to be careful of that. And of course, sometimes people will misuse other sorts of medications, whether they're prescribed or not. So that is something that we need to kind of be aware of and be careful about. And of course, because your immune system is compromised, it is going to be especially important to take good care of yourself as far as watching what you eat, staying hydrated, that sort of thing. I would say just in general, when we're under stress, we really need to kind of baby ourselves and make sure that we're trying to get the sleep, eat healthy, that sort of thing when we're under stress. And then the last thing I will say is limiting media exposure. Boy, there's nothing that makes us more stressed out than watching things on the media. They are really, the way that they present things is, you have to stay informed on the one hand, but a lot of times the way things are presented in the media can get us very distressed, especially here in the US, I will say. They make money by people watching or viewing or reading. And so just be very cautious about how you feel when you look at things in the media, because it can make things worse for people. I'm going to give a particular shout out to mindfulness. This is something that has been getting a lot of press, particularly in the last decade or two. We're starting to see a lot of research that has come out on the benefits associated with mindfulness. And mindfulness can mean a lot of different things. And there are a lot of different ways to reach mindfulness. There's actual mindfulness meditation, but you don't necessarily have to do mindfulness meditation. You can get to a mindful state without actually engaging in meditation. And what the mindful state really is, it's sort of having just sort of a clear focus on the present and your surroundings and experiencing it without judgment, allowing any sort of emotions that you have at that time, not questioning them, just allowing them to be. And there are a lot of practices that can get you to this point. Yoga, some people find that they get into a state of mindfulness by engaging in yoga or Tai Chi. You can do it through meditation, or you could just spend a few minutes just trying to be mindful. It's not something you want to spend your whole day being mindful. You really can't. You have to get things done, right? We can't just always be sitting and being mindful. But taking those breaks throughout the day, even just a few minutes to be mindful, has been associated with benefits. And for people who engage in mindfulness, particularly mindfulness meditation, there has been research to suggest that people tend to stop ruminating or ruminate. And ruminate is sort of having those worries in your head that kind of roll around in a loop. More insight into what is going on, less feelings of stress, and less being reactive to stressors. So jumping on people, getting easily angry or agitated. There's less of that when you do a lot of mindfulness. It's helpful for people as far as their memory and focus and ability to think. It improves people's relationships, because we all know that when you're under stress, you're not at your best, you're not your most charming, right? And it can reduce both anxiety and depression. I do want to say a few words about what we sort of expect when we're under a lot of stress, particularly really big things like this COVID pandemic, or major life stressors, and when we need to kind of seek help. So some of the reactions we have are expected for when we're under major stressors, but there's also a certain point at which we really need to go ahead and try to get some professional help. So when we're under some intense stressors, it's normal to feel like you're struggling at times. This is sort of a part of it. Having periods of sadness or feeling like you need to take a break, crying or being upset. This is normal. Having some nightmares, having difficulty sleeping or being irritable, moody, difficulty focusing or concentrating. So these are all things that are kind of par for the course when we're under an intense amount of stress. Now, if this is going on all day, every day for a long period of time, and you're finding that it's really interfering with your ability to work, do your job, be a parent, or engage in any other important role in your life for like 2 or more weeks, then you need to get some intervention there and try to get some mental health help. If you find that you're using a lot of substances to help you and you can't cope without using substances, even if it's something like alcohol, then you really need to think about trying to get some help, because that's dangerous. If you are engaging in violence related to the stress, if you find that you're hurting people in your family because you're very stressed out and you lash out in harmful ways to your family, or if you're in a relationship where someone else is stressed out and is lashing out at you and you're the recipient of that, that's a sign that people need to have some sort of intervention. Or frankly, if you're just feeling inside like you need some help and you want to get some help, then you need to go get some help. All right. So this is about stressors and how we deal with stressors and when to get help with our stressors. I'm going to switch gears now and talk a little bit about how we can sort of help improve people's mental health and what are some of the ways that we can engage in outreach. One of the first things that people think about is trying to increase the availability of mental health services to where people are. And when we think about farmers and farmer mental health, and a lot of times farmers live in areas where it's harder for them to get access to mental health care. We talked last time about some of those difficulties. And even if there are people available, there can be some stigma associated with it. It can be hard to get in. And even with things these days like telehealth, where we're trying to increase availability through remote means, it's not always possible to get out in rural areas, right? It's great. It's one more tool in our toolbox, is to try to do things like therapy online or therapy over the phone. Another thing that has been done is increasing the amount of therapists who go out to rural areas. We'll also talk a little bit about some of the health-based and integrating it into healthcare, school-based care. And then we'll talk a little bit about prevention and some of the ways that we engage in prevention. Okay, so telehealth. So telehealth is awesome, especially during these COVID times where you really didn't want to meet in person with people. The availability of getting therapy online has been tremendous. And this is something that has been particularly helpful for people in rural areas and for farmers to be able to get this. And it's something you can do through the web. There's also phone-based options or through the telephone for people. But there are some challenges in engaging in telehealth. So it's not just like the one-stop shop to increase availability out in rural areas or for farmers. Some of the things that we have been seeing is that there are some difficulties related to licensure. I know here in the US in particular, and my guess is in other countries as well, that there can be some differences in licensure. So for example, you may need to find somebody who is licensed specifically where you are. So I don't know within the European Union if there are some challenges with this as well. Can you have licensure for mental health professionals across those lines? Here in the States, you have to be licensed within a particular state to treat people. how do you know who you're treating and where they are? And so there can be some diciness that they're still sort of working out related to licensure. Here in the US, there was a great reluctance among insurance companies to pay for mental health care that has been provided remotely. During these COVID times, they have relented. And so that's a really positive change that has come out of this, is that they are more likely to be willing to pay for mental health care that is provided through online means or through phone. One of the things we see particularly in these rural areas is, which I mentioned earlier, is just difficulty with having the bandwidth to do a good job in some of this remote therapy. A lot of places where people live, frankly, even where I live, I don't have great internet. So it can be a little bit dicey trying to have that reliable internet service, or even phone or cell phone service can be really dicey out in more remote areas. And for people who are farmers, even if you can get this sort of therapy, it might not be offered at the time that is convenient for you. A lot of times for farmers, they're kind of working very long hours, and they may not be able to find therapists who are able to work with them at a time that is convenient for them. And if you're doing therapy at home, there can also be some confidentiality issues. Do you have a place where you can go where other people aren't going to hear you talking? Because you need to be able to be open and honest. And you may not want your family or your roommates or whoever is with you to hear what you're talking about. So confidentiality can be an issue as well. The last thing I will say is that online therapy, most people who engage in online therapy feel like it's as good as doing it in person. However, therapists themselves actually feel like it's not as good. There's been a lot of research to show that therapists don't feel as though they can see the cues as well. When they're doing it online, they don't feel that same sense of connection. So it can be, it's maybe not quite the same as doing it in person. I will also say, especially during these COVID times, just finding online therapy is very challenging because there's really just a shortage of therapists available. So even under the best of circumstances, telehealth can only do so much to improve our ability to increase mental health care. Something else that has been tried to sort of increase the availability of therapists out to rural areas and to farmers is to have the therapists go out. And this is great, but it can be really difficult and time consuming for people to get out to those rural areas, and not necessarily very efficient for someone to go out to a rural area. It can be more efficient for them. Why would I want to spend my time and gas money traveling out to a rural area when people can come to me? And especially when there's a shortage of therapists, people are maybe less willing to do this. So it can be costly, it can be time consuming. And then when you get to the rural areas, where do you go? Where do you provide your services? So finding those good locations can be challenging. And if you're providing therapy in a remote area, sometimes it can be sort of obvious. If you're going to the therapy office out in a rural area and people see your car parked out there, everyone knows that you're going for therapy, right? And there can be still some stigma associated with that. And so people might be reluctant to go out and seek therapy because they don't want to be seen there. And, the remote therapist comes out once a week. Well, that might not be when you can go. You may need your services at another time. And so that can be problematic, and people aren't as specialized. So, I may need somebody who deals with trauma, and there's no one who specializes in trauma who's able to come out. So there's definitely still some challenges. Even if we can get people to go out to rural areas, it's not perfect. Another thing that has been tried is trying to get behavioral health services integrated into the healthcare setting. And this has been helpful, particularly in rural areas. One of the things that I used to do is I would go out remotely to a health clinic here about an hour from where I live. And the good thing about this was that when people went in to get their mental health care, no one knew, because it was just a regular clinic. And so, you know, no one would know, no one would know who you were going to see. However, there's not always space available. Healthcare providers are not always willing to let people come in. Another way that this has been done is to sort of train people who are healthcare providers in some mental health techniques that they can use just to give some sort of care to people out in rural areas. But not all medical professionals are interested and willing in getting this, so this can be challenging as well. Another way that has been tried is sort of integrating it into the school system. And this is something else that I have been involved in, is providing child therapy services in schools. The positive from this is that it makes it really easy for children to get their mental health services. They're doing it right at school. And you don't have that stigma, right? Because people don't necessarily know where you're going. You know, you can be called away for whatever, and you know, it could be gifted services, it could be this, but you can easily get your mental health care there. One of the problems for this is that it can be hard. A lot of schools are not interested in letting people in. They need that time for academics. You don't want to take students away from their academics. So not all schools are willing to do that. Not all schools have appropriate spaces where you can go to have a private place to meet. You know, it was great when I did this because I was able to see the kids, but I was not able to see the parents. And so that was something that's kind of lacking. And when you work with kids, you really do need to have parents engaged and on board. And then finally, this is not something that's free. It's something that you need some sort of funding for. So school-based care can be great. But again, this is just one tool in the toolbox. There are some limitations to that as well. So now I want to kind of focus on, okay, so that's about increasing behavioral health care and getting it more out to people. Another approach that we can take, and this is more the mental health side and less on the mental illness side, is thinking about prevention and what we can do to increase the capacity of communities and individuals within communities to help prevent some of those negative effects from stressors. So this is something that is really important to consider, and we'll talk in a minute a little bit about some of the things that have been done. So one of the ways to go about this is to increase individuals' skill levels, teaching them coping mechanisms, teaching them about stress and how to cope with stress. There are other kinds of, like, say, drug prevention programs, especially that they do with youth. And there's also some prevention programs that are more what we would call secondary prevention. So people who are maybe more at risk, trying to work with them so that things don't get any worse. But I will also say that, you know, prevention programs require money, right? But there's definitely some good that can come of it if you can get that. It also requires community buy-in, and not all communities are going to buy into this or are going to be interested. I'll also say that prevention is great and we want to prevent as much as we can, but there's always going to be a need for treatment. So, prevention doesn't mean we don't engage in treatment. We still are always going to need treatment, but that can reduce the demand for treatment if we can engage in prevention. And this is something that I've become much more interested in as I become involved in cooperative extension, because I think that there are a lot of great opportunities for extension to get involved in some of these prevention efforts. And some of the things that we're thinking about here in Florida are engaging in some programs where we're teaching people some individual skills. We're also engaging in something referred to as gatekeeper training, which I'll talk about in just a minute. One of the great advantages for extension is that it's out in the community. It's out in these communities that we want to reach. And we're used to dealing with these people. These are people who are trusted, who provide good, unbiased information. And so this is a real plus in especially trying to reach some of these rural and farm populations. And I'm not sure internationally, maybe people are much more focused on agriculture, but here in the US, we also have people in extension who do engage in some of this mental health sorts of training related to stress management, relationship education, and things like that. But we can also engage in something that I'll tell you about, which are these gatekeeper training programs. And so the idea behind this is to get as many people in the community understanding about mental health and mental illness and how to refer. And there are a couple of really good, well-researched ones. There are many, many out there, and internationally, I'm sure there are tons out there. I'm just going to give a couple of examples of ones that are very popular right now and that have a lot of research behind them. So the first one is the mental health first aid, and this was actually developed in Australia. And this program has shifted a little bit over time. In the beginning, it was around 12 hours worth of training. They've reduced it now, so it's only about 8 hours, so something that you could do in a day. And this is really sort of meant in the same way that we teach people who are not doctors how to do first aid and deal with injuries, or how to do CPR, that sort of thing, help out in an emergency. So this is to help educate people who don't come from a mental health background about what mental health is, and help them understand how they can positively intervene in situations where people are struggling. So this is really helpful. They learn how to refer. They are more aware of what's going on. And this is something that has been adapted for use in many countries. And they also, at least here in the US, have a version that is specific for rural audiences. And so this can be especially helpful for people who live out in rural areas and farmers. You see sort of examples that relate a little more to you. That can be really beneficial. And what they have found in the research is that it increases knowledge and understanding of mental health. It reduces stigma. So the more people learn about this, the less likely they are to sort of judge people for having any kind of mental health issues. And it also makes people feel more confident in their ability to work with someone. I think a lot of times, if you don't have a background in mental health, when you see people struggling, you just don't necessarily know what to do. And this really helps give people more confidence in their ability to handle these situations. It also helps people themselves to get this training to feel better and to better deal with their own stressors and other people in their lives who are struggling. Another type of gatekeeper training is something called question, persuade, refer. And this was developed in the US. This is a much shorter training. This is only about an hour of training. So you learn less because it is only an hour. However, this sort of training is very much focused on suicide prevention specifically. The advantage to this is that more people are going to be willing to take this training because it's faster, right? Not everyone's able to give up a day or a day and a half of their time to do the mental health first aid training. So this is something that is more easily accessible to people out in the community. And it can even, and both of these now are able to be done online. But the idea behind this is to educate people about the warning signs for suicide and how to talk to people who are having suicidal thoughts, how to de-escalate, and how to refer them for appropriate care. And so the research has shown that this increases people's knowledge and their skills and their self-confidence in dealing with these types of situations. And it increases people's referral for mental health services. People just know how to handle these situations a lot better. And if you think about it, most people out in the community don't have any sort of training or understanding. And so having this sort of training out of large numbers of people in the community really helps. And it can really provide a lot of support for people who are experiencing these. So this is a relatively inexpensive program. It's something you can do online. And, you know, this is something that specifically targets not just mental health generally, but specifically suicide. Okay. Teresa, maybe I'll take a pause here before I get to the last part and see about addressing some of these questions. Because I see there's a bunch out there, if you could help me.
There's a question from Opik in Indonesia, and this person said, we have a problem during a pandemic, especially for farmers who manage their agricultural products but are constrained by distribution, which costs more. This left the peasants confused and depressed. What is the role of extension workers and agricultural institutions such as farmer groups in overcoming this problem?
Mm-hmm. I think that, as I have said, I think extension can serve in very positive roles. Just getting educated about mental health and how to talk to people when they are experiencing these problems can be very beneficial. If you can help disseminate information to the community is very beneficial. I think that some of these gatekeeper programs and getting just a little bit of training can be very beneficial. While it's not necessarily specifically your job to do this, it's something that you're going to come across. And we have seen this also here where I am, where people who are in agriculture, with some of the events that go on, some of these big difficulties, it's incredibly upsetting and stressful, financially devastating. People may lose their farms. And with COVID, you know, those distribution issues have been just really financially devastating. So we definitely have seen a lot of that as well. And our extension people are the ones who are meeting with farmers, right? You're the ones who see them a lot. And so, you know, you're sort of on the front line of talking to them. And if you can help recognize what's going on and can get some of these trainings for yourself, you're going to be in better stead to be able to talk to people and help refer them under these difficult circumstances.
We have a comment from Masha. Masha says, the problem we have with after school prevention programs is getting the kids home. With everyone living so far away, it can take hours before we can get the kids home.
Yeah. Yes. After school, there are certainly some great opportunities to work with students, but then you have some of those other issues, especially if you have to be responsible for transportation. That's very burdensome. Yeah, absolutely.
And then we have a question from Andy. He said, hi, Heidi, I am really enjoying your presentation. How widespread is the training, example on suicide prevention that you described? Is there any information on how effective it is?
Yes. You can, I had the links for both mental health first aid and for the QPR question, persuade, refer. you can kind of take a look, and they have information there about some of the research that has been done, but they both have a lot of research behind them and being very effective. So you can get information about how to get the training on those sites as well, and they are offering online. So it's out there and it is available. The question Persuade Refer is less expensive because it is a shorter training. So there's also, I know in these times, people have been getting funding to offer these trainings for free. And I know I have recently put in a grant to try to get some funding to provide this for free to people. So those opportunities are starting to pop up. But again, getting this training, it's not that costly to get it. So it's just, I think it's only around, maybe for us here in the US, around $10, something like that, to get the training. So it's relatively accessible.
Okay, that covers the questions.
Okay, great. All right. So I'm just going to give you guys some tips that you can kind of take with you as far as thinking about how you interact with people who are under stress and who are in distress, and how to provide them with support. I think encouraging people to engage in good stress management techniques. So some things that they can do to take care of themselves, which we had sort of talked about, making sure they're getting sleep and eating right, getting their exercise, getting emotional support, watching their thoughts, some of those positive things, and encouraging people to do that, to take care of themselves when they're under this tremendous amount of stress. You'll also want to link people up to whatever sorts of, especially if they're experiencing a lot of financial distress, which I know a lot of people in agricultural communities, that's what really brings them into a lot of distress, is some of the financial stuff. So helping them get to those sorts of resources is very beneficial as well. I think a lot of times people worry about how to provide the best support, but in all honesty, most people just want someone to listen. So if you are open to just being there to listen and hearing their stories, for a lot of people, this is what they want to hear. If you have some good resources for them and sharing that with them, I'm sure that that's really helpful. But sometimes just listening and just not judging them and allowing them to sort of tell their story can be incredibly beneficial. If you have any sort of good mental health handouts for people on what they can do for taking care of themselves, if you are aware of where people can get mental health locally, any kind of resources locally that you're aware of that you could compile, that you could give to them, could be beneficial for those referrals to people. And as we talked about, sort of obtaining that gatekeeper training, or providing some of those informational programs out there related to managing stress could be really useful. But on top of that, just thinking about how you can be the best listener that you can be. Usually people want to tell their stories. And I think a lot of times as listeners, we want to try to jump in and try to fix the problem. I think trying to kind of prevent yourself from going there right away is really beneficial, because really people just want to be heard a lot of times. So being able to sort of listen and let them know that you are hearing what they say is really important. And so this is a technique we would call reflective listening, where you hear something that they say and you kind of say it back to them. You may say it a little bit differently, right? You don't want to just echo. Sometimes you can just say exactly what it's like. Oh, so it sounds as though, your farm's not doing so well. It sounds as though you've been under a lot of stress. Basically, rephrasing what they say to you to make sure that you're hearing them. Sometimes we think we understand what people are saying and we're not quite getting it. And so that's why it's really important to kind of restate back to them what you think you're hearing, because then they can correct you if you're wrong, but it gives them a sense of feeling heard that you understand them, when you can kind of tell people back what you are hearing them say. And it's also important to engage in communication that is supportive. And we'll talk about some of the different ways that you can be supportive in your communication. I will say that while a lot of times people just want to tell their story, not everybody enjoys talking about their problems, or they're not ready, or they're just not comfortable. So if people don't want to talk about what's going on with them, it's okay. You can leave them be, and don't try to pressure people to talk if they're not ready. And I will also say that it's important to consider your own reactions and what this does to you. And like we talked about earlier with the stressors being unique, not to make assumptions about what people are going through based on how you think you would react. So maybe something wouldn't be a big deal for you, but it is a big deal for them, or vice versa. You know, you might assume that things are worse for them than they really are. So just be careful about how you react, and maybe some of your, sometimes I know of me, I'm terrible. I cannot play poker. I show things on my face right away. So just be mindful of that, and be careful of that. So one of the things you want to do when you're listening to people is provide empathy. So that is a sense of, I care about you. Like, you know, I know you're going through a lot. How are you holding up? Is a way of showing people that you care. You want to normalize how people are reacting. And so, you know, hey, when you're under this tremendous amount of stress, it's okay to feel this way. It's okay to have these sorts of reactions and to be really distressed. So we understand, you know, you're feeling a lot of despair because of what you're going through. You know, it's a normal reaction to some abnormal events. I think giving people a sense of, you know, how they're coping, and that everyone copes in their own way, is really good. You know, it sounds like you've been doing this to try to get through this time, and that's really good. Maybe helping them to think about other ways to cope that might be more positive. Encouraging people to engage in self-care and some of those good stress management techniques. Just saying things like, make sure you're taking care of yourself. You need to baby yourself as much as you can, you know, get in some, make sure you're eating. A lot of times when people are under stress, they may forget to eat, not hydrate, do all those things that are really important, because your immune system is compromised, right? Tolerance for change. I think that a lot of times when people are in incredible distress, it is going to mean that things have to change. And, you know, just giving people hope that they can deal with this. You've dealt with hard times before, you've dealt with change before, and I know you're going to find a way to get through this. And relatedly, sort of instilling hope in them that they will get through this, that there will be a new normal. You're capable of all that. And then also giving people that sort of permission to get help. Like, it is okay. Sometimes we all need to get some help, and that's okay. You know, just recognizing that you need help is a sign of strength and not weakness. And those are some ways when you're talking to folks who are distressed to sort of give them what they need. For the next portion, Teresa's going to be taking over, and I'm going to go ahead and maybe let her share her screen and get that going. Let me stop my sharing, and I can kind of focus on looking at some of these chats and questions and comments.
Thank you very much, Heidi. Thank you to those of you who have introduced yourself in the chat. If the others of you could please introduce yourselves, and when you're sending your introduction, send it to panelists and attendees so everyone can see or know who you are and where you're from and what you do. Thank you.
All right, thank you so much, Heidi. So I've got a lot to cover, so I'm going to move a little bit quickly. I hope you can go back and play this recording slower. I'm a pretty fast talker, but we'll get through as much as we can. So
Teresa, we're seeing your notes page on the
I'm
side
so sorry.
also.
Thank you. Let me fix that. What's going on? Just have to. Okay, how is it now? Is it still
Yes,
my notes?
that's
Okay, awesome. Thank you. Okay, so great. So Heidi, thank you so much, Heidi. I think it's really important to talk about what we can do on an individual and interpersonal level to take care of our own mental health and also support farmers that are dealing with stress, right? So for my part of the presentation, like Heidi talks about, I will be covering more of what can be done on a societal and community level. I know Heidi touched upon that as well. So before we talk about the bigger picture solutions or interventions, I just want to quickly go over this model. This is called the social ecological model. It's used by researchers to understand social issues such as mental health and also how prevention strategies could work. And like you can see, there's these different levels: the individual, interpersonal, community, and societal. They all interact with one another. And this model also shows that if the most successful interventions are going to address all of these levels. So we'll have more people taking care of themselves. We'll also have better structures in the community and in society to help deal with this really big issue, right? So Heidi talked about individual, interpersonal, community. I'm going to talk about the bigger picture interventions. And I think all of you as rural advisors, you are very well positioned to address all of these issues. So on the individual level, you can help take care of yourselves and also those around you, but you also have a big influence on your community and your society. So I hope that you'll address all four of these in your work, these levels in your work as rural advisors. Okay, so I very roughly outlined separated these by societal and community interventions, even though there is some crossover, and Heidi and I have a little bit of crossover here. So I'm going to just provide examples of communities that have introduced some of these interventions. And by societal, a lot of these are policy, especially national policy changes that affect the greater socio-political environment. So here we go. Okay. So on the national level, I think the most important thing for helping farmers and kind of helping address this issue at the root is having a humane, united, holistic food policy. So as the presentation last week made clear, the modern food system in many and really most places is very dysfunctional. And farmers across the world are dealing with mental health issues, but also we're dealing with other symptoms of dysfunction. So we've got food-related diseases such as malnutrition and obesity. We've got a lot of environmental problems, food insecurity, distribution issues people have mentioned. And even though COVID has made these problems far worse, right, and really brought them to the forefront of public attention, there have been problems in the food systems, in most places, food systems for a very long time. But despite the fact that food systems are really they're extremely important, maybe the most important system to support human life, very few nations have a coordinated food policy on the national level, right? So most national food laws and policies are really complex, and they're divided and they're separated into different government agencies and different laws and different foreign and domestic companies and stakeholders and community organizations. And oftentimes there are policies that will conflict, that are redundant, and these can create efficiency. And rarely is farmer well-being at the center of any of these policies, or it just gets left on the wayside because of all of the competing interests. So having a united holistic food policy that takes into account all of the stakeholders. So we've got our little farmer. I love this picture, our farmer here and our nurse and our food worker. That is really important to helping solve the bigger picture of food system dysfunction. So I would quickly like to go over 3 aspects that are essential to an effective food policy agenda. The first is cross-agency coordination of policy and regulation. The second is humane trade policies. And the third is support for sustainable humane farms. So first, let's go over cross-agency coordination. As I talked about last week, the fact that regulations and farm policy and food policy is so disconcerted or uncoordinated is actually a major stressor for farmers. They often will cite regulation compliance as more stressful than even financial distress. And so that's one piece that's important. Having it more regulated reduces the burden on farmers. But having it coordinated across all agencies, having one united goal is going to include farmer well-being will be considered, rather than, instead of just being an externality, a side effect. It's something that is taken into consideration at the very beginning of the food system and of national laws and regulations. So happily, a few countries have actually begun to adopt national food strategies and to address these really complex issues within their food systems. And there are signs that coordination is improving farmer well-being. So the example about which I'll speak today is Norway. So Norway, it was one of the first countries to adopt a food policy. It did this in 1975, and in response to high rates of heart disease, and also a food crisis that really brought to light Norway's dependence on food imports, and highlighted the decline of the nation's farm sector. So they launched this national food strategy that was focused on food security, specifically by improving domestic food production, maintaining farm activities throughout the country, and increased value creation and sustainable agriculture. And this strategy, it hasn't been perfect, but it's actually been extremely successful in lowering rates of heart disease. And Norwegian farmers, even though they're experiencing some of the same stressors, the suicide rate among this population is not elevated, and it's especially low compared to neighboring European countries. And Norwegian farmers report feeling much more life satisfaction and satisfaction in their job than a lot of farmers in Europe. So this strategy has been so far mostly very, very good. So the second aspect of a unified food policy is humane trade policies. So I'm sure many of you know that trade policies have a really huge impact on the farming economy and are one of the main causes of widespread financial distress among smallhold farmers, right? So we talked about this last week, but globalized markets, they don't necessarily need to, but 90% of the time, they do lead to financial distress among smallhold farmers. And that's because the ground of global capitalism is very unequal. And it's a complicated topic, and it really requires its own webinar. But trade deregulation, what usually happens is that the middlemen in agriculture, so the processors and the retailers, there will be a lot of consolidation, and they'll grow into these really huge multinational chains and agri-food chains, and they control a significant part of the market. And the leverage between these small farmers, and there's no leverage between the small farmers and these big companies, right? And if you're a big company, you're not going to want to deal with, and you have to supply millions of grocery stores around the world. You're not incentivized to deal with a small farmer. It's just not as efficient for you. And the small farmer doesn't have any bargaining power when he's or she is just one of millions of other small farmers, right? And unfortunately, most of the time at the national level, when there's agricultural policy or trade policy is being considered, it's these small farmers, the livelihoods of these small farmers are not taken into account. Usually economists, not always, but many times, the economic advisors will consider only the net GDP effect, right? So how much wealth will be generated in total. And most of the time, this wealth is generated by the middlemen, not by the farmers. So the amount that they receive at the farm gate will actually be lower after trade liberalization. So it's very important that we have policies at the national level to correct this imbalance. And this can be done in a multitude of ways, including investment in farmers, associations, and cooperatives, so they have a little more bargaining power, right, as a collective. Farm and business assistance, and enforcing fair competition, making sure that those middlemen companies don't become monopolies and are able to extract unfair prices, right, from the smaller farmers. Another important aspect of trade policies is holding food imports to domestic environmental and labor practice standards. And again, these are really complicated. This is just in general. In principle, very important. In countries with lower food production standards, it's often cheaper to produce food than in countries with high standards and heavy regulations. And this problem is really seen, I think, starkly illustrated in Sweden, where right now there's a crisis among dairy farmers. And part of it's a complicated crisis, but part of the issue is that Sweden has some of the strongest regulations regarding animal welfare in the world. And it's expensive it's more expensive for Swedish dairy farmers to produce milk in order to comply with these regulations, right? But in the marketplace, they are competing with milk from countries where they don't have these regulations, and it's much cheaper to produce milk. And many consumers, when they go to the grocery, they don't understand these complex regulations or market forces, and they'll just buy the cheaper milk, which is really devastating for Swedish dairy farmers. So making sure that imported foods are held to the same standards can really, or that consumers know about this, can really help protect domestic producers. And the last I want to talk about is ending dumping in global markets. I'm sure many of you already know about this. This was news to me. So dumping is the practice of exporting commodities at prices below the cost of production. And what this usually happens is that agro products from Western countries, often heavily subsidized, there will be a market glut, and so Western countries will dump their products into the markets of less developed countries to help bring down those prices. And this is really devastating for farmers in developing countries because they often don't have those subsidies. And so it's more expensive for their crops are more expensive, and they can't compete with the crops that have been dumped on the market. Okay, so I want to share a story of a developing country that was actually able to integrate its small farmers into the global agricultural economy. And this is Armenia. I don't know if we have any Armenians here. But what happened in Armenia is the government, it recognized that agriculture was going to continue to become more and more globalized, more and more commercialized. And they wanted to make sure to include these goat farmers, small goat farmers. So they worked with the United States Department of Agriculture on a goat industry development project. And they did this by cooperativization, they helped the farmers form community-driven cooperatives. And the approach was really it was very, helped the more education-based. They helped the farmers understand the global markets, to set goals based on market-driven value proposition, right? They worked really hard to develop democratic structures, transparent leadership. They provided support to help to invest in the technology that they needed to transport the cheese. It was mostly cheese. Transport the cheese to the global market, to make the cheese, to store the cheese, to meet the standards that the countries they were exporting to required for this cheese. And it was really incredible. And now consumers in Russia and in California and in the United States are able to buy cheese made by these farmers, and these farmers are able to actually collect a fair price on this milk, and it's helped lift a lot of them out of poverty. So if you're interested more on kind of the really fine details of how this can be done, I encourage you can just Google Armenian goat industry, and there's a lot of great information out there. So lastly, I'd like to talk about support for sustainable farms. As we talked about last week, pesticides are a big contributor to mental health among farmers, and not just this, but the overuse of agrochemicals can be a threat to farmers in the long run because of soil degradation and chemical buildup. And this is especially a problem in developing countries, but also in the United States and in Europe, where a lot of arable land is being lost because of erosion and pollution from agrochemicals. And so for many farmers, they use these agrochemicals because they have to. It's all they know, or it's what they need to do to make a profit to support themselves. And so even though this might help them survive in the short run, it can be very devastating in the long run. So it's important that on a state, really nation state level, that we support farmers in being able to switch from maybe not so sustainable, but short-term necessary agricultural methods to more sustainable agriculture. And a great example of a country that has really done a lot, it really developed where the sustainable agricultural sector has grown is Egypt. And it's largely because of this company called Secom. It's a consortium of companies, and they produce sustainable food, textiles, and pharmaceuticals. And they actually do it on recuperated desert land. And as part of their farms, they also have medical centers and schools and a university. And this program, this company started as a private initiative, but was able to grow to where it's become a huge player on the Egyptian market and a major employer because of loans from development banks, right? So farmers that work for Secom, they are paid fair salaries. They're paid almost 4 times the average salary of Egyptian farm workers. And because of the huge market share that they've developed, Secom actually has contributed to the reduction of artificial fertilizer and pesticide use in Egyptian's cotton industry by 90%, all while in boosting yields, right? So with the proper investment, farmers are able to transition to more forms of more sustainable and less harmful to themselves, their mental health, and the environment agriculture. Part of the sustainability of farms, of allowing farmers to continue to keep farming in a healthy way, is access to funding. So last week we talked about how financial troubles, and Heidi mentioned this, are at the heart of many farmer mental health issues. And access to credit is especially problematic because the farmers, they need the money. They need the money to improve productivity, to smooth household cash flow. Someone talked about markets to meet the demands of their buyers, and also to even just to get their food into their products into the supply chain. Unfortunately, access to credit is a big challenge, especially for smallholder farmers, because conventional financial institutions like banks, it's risky to lend to smallholder farmers. Weather is crazy, and climate change is making it worse. And oftentimes these smallhold farmers, when they can't get access from a formal bank, they turn to money lenders and loan sharks. And these loan sharks can be very ruthless and go after them and their families. This will many times lead them into ruin and suicide. Actually, sort of loan sharks falling to debt because of money lenders, and the pressure from money lenders has been identified as a primary cause of the suicide epidemic among farmers in India, where loan sharks are some of the biggest providers of financing to farmers. So providing farmers access to funding through official channels, so state lending programs, mutual benefit societies, trade unions, workers' cooperatives. This can help those farmers make the changes they need to keep farming and to make their farms sustainable, but it can also really strengthen their rights and protect them from falling into insolvable debt and despair. So a great and innovative intervention for this problem in the United States that has helped mitigate the stress of financial issues among farmers is farmer-lender mediation programs. So during the peak of the American farm crisis in the 1980s, hundreds of thousands of farmers had their farms foreclosed upon by their lenders. So they weren't able to pay back a debt, and lenders came and took their house and their farm, their land, right? And foreclosure is super stressful for anyone, but it's especially stressful for farmers, because when they lose their land, they lose their way of making money, right? And they'll never be able to pay back the loan because they don't have the land anymore to farm, so to make products. And recognizing how traumatic this is, Congress created the Farmer Lender Mediation Program in 1987. And this program requires any lender that starts debt collections to offer farmers the right to participate in a 3-month mediation process. And during this process, collections are forbidden. They can't come and collect anything. And if a farmer chooses to do the mediation, they'll have a mediator come. And oftentimes this is a professional, was always a professional, impartial facilitator. But in many countries, the agricultural extension agents will act as mediators. So they have a knowledge of the farming world, of issues of both the banks and the farmers. And mediation has been shown to really reduce the stress of financial issues. It's low cost, it's confidential, it's also much faster than litigation, right? And it often does help resolve disputes within a farmer's financial means. And this has been credited as really helping bring down the suicide rate among farmers in the United States. Okay, so the second big intervention, societal intervention I want to talk about, is the provision of better education and rural infrastructure. So Heidi talked about the importance of education, and really these two here, we've got a visualization of the 5 social determinants of health. But access to education and rural infrastructure are especially critical to helping agricultural communities adjust to a very, very much globalized world. As I talked about with trade policies, modern agribusiness supply chains are very complex, and they're really uneven. The balance of power is very uneven. And farmers need to be able to understand a lot of these dynamics in order to survive. In the past, maybe a farmer's technical knowledge was his most important or her most important aspect. But today they really need to have strong analytical and critical thinking skills to survive. And these skills can be developed, need to be developed in their education. So in addition, it's also been shown that farmers who are to understand these global forces a little bit better, these bigger structural forces, their mental health actually improves because they don't feel so much personal guilt about their struggles. They can know that the reason that they're struggling, it's not because they're a bad farmer or they're a failure in their family. It's because there's a lot that's outside of their control. And this can really, really build and be beneficial. In addition, it's likely that commercialization is going to continue, and that more, especially small farmers, are going to end up having to leave the profession. They won't be able to make it. And if they have a strong educational basis, they can move on to other sectors. They can also help develop non-agricultural sectors in the rural economy. Investing in rural infrastructure such as transportation channels, this is also really important to enable small farmers to get their products into the supply chain. And as is communications infrastructure like broadband internet, right? I mean, Heidi talked about this. This infrastructure, it won't just facilitate access to the market, but also to mental health services, which we know that we need. A great example of a community that did this is Walla Walla, Washington in the United States. So Walla Walla in the 90s, it was really struggling. The agricultural sector was dying, and in order to resuscitate the economy, the community invested a lot in a wine program at the community college, at Walla Walla Community College, a wine, nursing, and wind turbine technician program. And these programs have been incredibly successful in revitalizing the community. And in 2011, new Walla Walla Community College graduates actually earned twice the amount of other new hires in the region. So investing in education, it can pay off in very tangible ways. All right, so another big one, big policy that needs to happen as at the national level is improved statistics taking. We talked last week about how there's just not a lot that we don't know as much about this issue as we'd like to because of the lack of data. And this is really too bad because many countries already take detailed census records of what's going on in the agricultural community. And if they could add questions about mental health, this would be pretty easy way to get a better gauge on what is going on and help develop timely interventions. And this is especially true for, I think, suicide statistics. So quick example, in Japan and Korea, these are two countries that really struggled with high, kind of notoriously high suicide rates. They part of their way of tackling this issue is by requiring municipalities to release detailed suicide records every month, right? And when it's on a monthly basis, they can really sense what is going on in the community, who's effective, and come up with detailed strategies for intervention. They've been very successful, actually. They're still high, their suicide rates are still high, but in lowering their suicide rates. Recently, Japan has this policy of releasing suicide rates monthly has been lauded because they were one of the first nations to realize that during the COVID-19 pandemic, young people were committing suicides at much higher rates, right? And that's because of they were releasing these suicide statistics so quickly, and they were able to intervene much faster than, I think in the United States, we're still waiting on that suicide data. So this is a really great intervention. Number 4 is regulating lethal means. So we talked about this last week. Lethal means are a big reason that farmers, a big risk factor for farmers, because when someone commits suicide or dies by suicide, it's usually during an acute period of heightened risk when they just can't stand it anymore. This usually doesn't last for very long when they decide they just rather not be here, or they can't deal with the pain. But it can really end in minutes or hours. And so restricting access to lethal means like guns, chemicals, pesticides can help prevent suicide. And this has actually been shown, really regulating lethal means has been shown to reduce suicide among farmers in England and with guns, and then also pesticides in Sri Lanka. So for those of us in high income countries, this might be surprising, but in lower income and more agricultural societies, pesticides make up a huge proportion of all suicide deaths. So in China, it's actually close to 50% of all suicides are by pesticide ingestion. And in India, it's about 40%. But banning particularly lethal suicides has been shown to really lower the suicide rate. After Sri Lanka banned a number of particularly dangerous pesticides, including paraquat, their suicide rate fell by half within 7 years, right? And that's not just, of course, it was more complicated than just the pesticides, but it was a major part of that. Evidence from South Korea suggests that even smaller policy changes, like retrieving canceled pesticides from the marketplace, educating farmers about the safe use of pesticides, and educating farmers to secure pesticides under lock and key can prevent suicide. So, okay, so we're going to shift gears. We've done the bigger society ones. We're going to talk a little bit more about community interventions. So Heidi talked a lot about increased access to mental health support, and how even though there's a huge lack of mental health providers around the world, that we can train non-psychiatrists, non-psychologists to be a part of that solution. So I'm just going to go over some concrete examples of this. So in the United States, the state of Minnesota, they've done a really good job at providing farmer-friendly providers. So like Heidi talked about, the therapy, someone has to be very open, very vulnerable. And so counselors really need to understand their client's culture and how their culture impacts them. We talked about last week, right, how a person's culture can have a really big impact on how they interact with the health system and how they take care of themselves. And studies show that when providers are maybe culturally insensitive or incompetent, that farmers will avoid seeking help. They can drop out of treatment, or even be misdiagnosed, right? It's hard enough for someone who grows up in a culture where you're not supposed to talk about your problems openly. And then you go to a counselor and they don't understand your problems. It makes it even harder. So in Minnesota, the state has hired 2 counselors to be full-time farmer counselors for just farmers in the state. So farmers in distress, they can call up Ted Matthews, he's pictured here, or his colleague Monica McConkey, and they will go and visit them on their farm. They'll talk to them on the phone. They'll invite them to come to their offices whenever they want, and for as long as they wish. And this is totally free. And because these 2 counselors serve only the farming community, they've really built up a strong relationship with the farming community. And there's a lot of referrals that they get from other farmers, right? And part of the success is that both of these counselors really understand the farming community. I think McConkey comes from a farming family, so they can understand the issues that are so stressful for farmers when maybe a counselor in the city would not understand so well. So that's an important. And the state of Minnesota, this has been so successful that they've started a 24/7 farmer wellness hotline that is run by mental health counselors that are trained by Matthews and McConkey. So they've been able to scale it as well. So Heidi talked about also training non-mental health care providers, so nurses and GPs. This has been extremely successful. This is an example of the American nonprofit AgriSafe offering a webinar on how nurses can help the mental health of people in farm and ranch country, right? Veterinarians are they're really well positioned to kind of provide a little bit of that mental health support because they're trusted by farmers, they're trusted in the communities. And this is in the UK, an event to help train veterinarians on mental health issues. Another great example is of having lay people help farmers is peer support and mentoring. So many countries I think particularly the UK, Australia, and New Zealand, they've had a lot of success in hiring these quickly trainable support workers. Most of the time, these are peer supporters. So they're people who have mental health issues from the target population, usually the rural population, and they'll use their own experience of recovering from mental illness to support their peers that are in mental health recovery. And support groups and mentoring programs have also been shown to be very helpful in this population. An example of a support network which really optimizes peer learning is FarmStrong. This is a New Zealand-wide rural well-being initiative, and it offers a really full spectrum of wellness activities, and these are all tailored toward farmers. But the key to its success has been sharing farmer-to-farmer stories on social media channels and rural media about what works for them. So I encourage you to Google FarmStrong and watch some of these videos of farmers talking about, I realized that I was taking care of my cows, but I wasn't taking care of myself. So I took the time, like Heidi talked about, I took the time to be alone by myself or to exercise or to eat healthfully. And these have really been successful. It's really resonated with the farmer community. Heidi talks about gatekeepers, so I'm going to skip this, but in Australia, they've found that training bush accountants, so financial people, so accountants and bankers in the countryside has been extremely helpful because farmers interact with these people a lot. And because a lot of times mental health issues are intertwined with financial issues. And so these issues will manifest. And if bankers and accountants understand how to talk to people with having these issues, they can encourage them and help them get help and take care of themselves. So this is a great example out of Zimbabwe, which has the 66% of the population is employed in agriculture in Zimbabwe, but I think there are only 9 psychiatrists in the whole country. So a psychiatrist there, he realized that he needed to do something. So he actually started a program called the Friendship Bench, which trains grandmothers to be kind of mental health supporters. And as part of the program, people who are suffering from mental health issues, they will just go and talk to a grandmother, like pictured here, and the grandma will listen to them, like Heidi talked about, have that empathetic listening, the reflective listening, and then they'll go through with them, they'll talk to them about what they can do to work through their issues. And this also, there's a lot of research supporting how the effectiveness of this program. And again, these are, grandmas, they're people who have the time, who are trusted in the community, who, when there's not enough mental health counselors, can step in and help people with their issues. Crisis lines are also very helpful. So like I talked about when discussing lethal means, the risk period for suicide, it's pretty short. So having someone there to listen to you, to provide support, to connect you with help in that moment can save your life. And so crisis lines, they're really great because most of the time they're run by volunteers without advanced degrees, but research suggests that these non-experts, if they have the proper training, they're actually just as effective, if not more so than professionals. And just calling in and getting validated and having someone listen to you and having someone work through your problems with you can really help lessen feelings of hopelessness and pain. And there's evidence that this lasts. Like I talked about with therapy, having someone on the other line who understands your issues, so someone who's trained in farming culture, really makes this a much more effective intervention. So Farm Aid, this one pictured here, has been it's very well used, and Farm Aid offers a lot of different aid. They offer financial assistance and food assistance, and so farmers who call in, they'll often talk about the financial issues, and then it becomes clear that they have some mental health issue stuff going on as well, and the people on the line are able to help them with that too. And that ties into the second part of community support, which is increased access to ancillary, so non-mental health, but also essential advisory services, right? So people like Extension, right? Agriculture advisors, financial counselors, mediators, business advisors, family therapists. Because oftentimes the stress that might be leading to these issues, it's really complex. It's from a multitude of different issues. And if they can have free and easy access to people to help them with these issues, as well as the mental health issues, it's going to be a lot more effective. And many countries are trying to offer these kind of one-stop resources. This is out of Australia. You can see, you can go to this event and see an accountant, lawyer, rural advisor, banker, property valuer, succession planner, marketing advisor, property marketing, and agricultural consultants. So any problem that you have, you can deal with it right there. And New Zealand does this as well. And the United States, this program, this is based in New York State. When a farmer in distress calls, they send out 2 consultants. One is a mental health expert and one is a financial expert. And they found this to be a really winning combination of helping farmers. So the last thing I'll talk about is community building. So like we talked about last week, isolation is a big risk factor for farmers in developing mental illness and committing suicide. And this is related to rural depopulation because humans are social, we're social beings, and we really need community to thrive. So having community support and just community events even can be very protective of farmer mental health. This is an example of from FarmStrong. FarmStrong, actually, one of the things they do is they organize comedy shows in very remote rural villages, just to give people the opportunity to come together and laugh, like Heidi talked about. It's very, very therapeutic, very good for mental health. Producer networks is being a part of a producer network where you have peers that you're working toward a common goal, that you can come together and maybe talk about that issues, to know you're not the only one that's struggling. This has also been shown to be very protective of mental health. But it's not just producer networks. Any opportunity that a farmer has to come together, this is farmers that are part of an activity called the North Yorkshire Cornfield Flowers Project. And farmers in this project really showed a lot of improvement in mental health, just coming together to talk about flowers, because they're able to build a sense of identity and community and belonging. And I'll skip this. So just to tie this up, as you've learned all of these things today, I'd like you to remember the 3 ways that you can really make a difference in this area, especially as rural advisors. And the first is just to support people who are struggling. And this starts with taking care of ourselves, right? If we're not managing our own stress, we can't be supportive of others. But then also listening, like Heidi talked about, listening empathetically and allowing people the chance to tell their story and not be judged. The second is advising, right? So we can, for farmers who are experiencing high levels of stress, we can talk to them about ways to de-stress, to take care of themselves. We can, to get help, right? And the type of evidence-based help that they have access to. And lastly, advocate. So we can disseminate a message of hope and support by educating our communities on mental health, on stress, by reducing stigma, by telling people it's okay. A lot of people are struggling. A lot of people have issues. And this can be done through many ways, but you really just talking about it, calling your elected officials, participating in awareness events. These are all ways that we can help. So that's the end of my presentation, and I look forward. We've got 9 minutes for questions, so thank you very much for your attention.
Thank you, Teresa. And Heidi, you could move forward with the questions.
I am not really seeing questions so much. A lot of introductions of people, or just comments on that this goes with their experience. Let's see. Let's see if there's anything new here. I see a comment, Purdue Extension offers virtual mental health first aid courses that anyone can register for and attend. And they give a link for that, which is really great. But yeah, I'm not seeing any questions yet. Oh, there was another comment about someone who's an occupational therapist who specialized in mental health for over 40 years, and they hope to partner with their agricultural program to prepare students for work in agricultural areas and addressing mental health issues. So there are a lot of supportive professions where this can be helping to get this information out to the community. Carl noted that the webinar will be uploaded, that it will be on the GFRAS site, and I think everyone who registered will be able to get a copy of the presentation. Someone commented that their local technical college has made mental health first aid as part of their nursing curriculum.
Teresa, if I may ask a question. If I am an extension worker somewhere in the world.
Carl, I think you lost.
Sorry, Carl, I lost your audio. Oh, Carl, I'm sorry, we lost your audio.
I think you're on mute, Carl.
Oh, we still lost your audio. I'm sorry. Do you want to type the question? Okay. While Carl is typing, I just want to shout out, I see that Robin Hatch is here, and it's thanks to her. This is how in Utah, that's how my family got involved in NAMI. So that's how it's thanks to Robin that I got involved in this topic. So good to see you here, Robin.
And I see we have lots of representation from the Philippines, and we would like to thank their College of Ag Ed and Communication for joining us today.
Very good question. If so, Carl writes, if I'm an extension officer, is there any tools online that on this that I can tap into? Heidi, I think I'll let you take that one.
I think that we've talked about some of the gatekeeper trainings that are available that you can participate in to sort of get yourself some training so that you can do a good job. I think that's some of the best that you can do. I think if you Google online, there are a lot of great just some handouts and things that you can get to have on hand. And I think I talked about just making sure that you're aware of where locally people can get their mental health from and be able to refer people. I think those are some of the great things that are out there. There's definitely a lot out there. There are certainly a lot of programs. This is, we've tried to give some good examples of some of the things that are out there, but there is a lot out there. There are a lot of great programs. So hopefully this will give you some ideas of things for your area that you might want to check in and see about getting some additional resources.
Thank you. And I'll just add really quick. We've been lucky as far as the pandemic goes, because a lot of time, like I think mental health first aid used to just be in person, but now it's online. Now everything's online. So you should be able to access something wherever you are.
I noticed that there was a comment from Marissa from Argentina, and my my Spanish has degraded, but my impression from what she had said is that it's kind of good that we're sort of looking at some of these what were sort of like the traditional ways of dealing with mental health issues. And, we're sort of rediscovering, in a sense, some of these ways, like that friendship bench. I mean, that was sort of something that happened more naturally in society, right? Like, older people would talk to younger people and give them advice, and building some of these social networks. Like, this isn't something new or, groundbreaking. This is stuff that is more traditional, or tapping into some of those good resources that we already had in the community is really good. So I think that that's a good point, Marissa, that yes, a lot of this stuff isn't necessarily groundbreaking or new, and that, we really need to sort of think about how traditionally we've been able to kind of provide these sorts of supports to people. Okay, Carl mentioned that Ingrid will present next week's webinar because his mic went out. So Ingrid, if you could give a little bit of information about next week's webinar, that would be great.
Yes, I mean, I think we will still, I'll just briefly introduce. So next week, next Friday on the 19th of March, we will gather at the same time from 2 to 4 Central European time, 2 to 4 p.m. And what we will focus on are really on some case studies or experiences that we have from across the world, from various regions, related to support to farmers and extension workers when it comes to mental health. So we will have 4 presentations on some of what we call best practices or these programs that exist in different regions. We will focus on them, and we will try to also identify, is there anything that is cross-cutting? What are the learning opportunities here, cross-region learning opportunities, just so we can be more and more aware of what's ongoing, what are good practices that we can maybe adapt also to our context. So we will have Birgit Bratengeier, She will present a case from Austria. We have Dr. Paramasivan Saturaman, who will present some aspects on the Indian context. We have Siani Marima, who's attending here today from South Africa. She is an expert and is also a smallholder farmer. And we will talk about some of these issues in her context. And we have Dr. Tessa Berry, who will present from the Caribbean region, especially in relation to post-disaster recovery, what are initiatives and what are programs that affect and that can support people. So I really look forward to having you here. What we will do is, because there was so much interest and so many interesting ongoing initiatives from various regions, we will add a fourth date, the Friday after that. It's the 26th of March, so we will have yet another, but we will talk about it next week, just so you can put it on your calendars. Those of you who registered will also get the links and the invitation for this extra webinar. It will be a focus on the European context, but we will also have examples from across the European region. So John McNamara, who was attending here, saw today from Ireland, will also talk about, and we will have a variety of other experts who will present some of these initiatives that hopefully can shed a little bit of light and can be supportive. So we're looking forward to seeing you there. If you go to the GFRAS website, just quickly, it's www.g-fras.org. You will see the recording from the first webinar is also available there on the front page. And as soon as we have this presentation will also be available on the GFRAS website. And we also distribute it over email. You know that email is tricky. Sometimes it lands on people's spams folders, but you will be able to access that. It's also on the GFRAS Facebook page and on our front page of the website. Thank you.
I just wanted to say that there were a couple of resources that people put in the chat box. Some from Purdue University. There's a farm stress team with resources, and someone provided a link through Purdue Extension related to farm stress. And then someone, Deb, gave a link for a self-paced program from the Kansas corn growers. So if you're interested, there were some additional resources that are available in the chat box.
Heidi, I know we're out of time, but there's one last question I'd like you to answer before we go. What are the indicators to measure when examining mental health?
What are the indicators to measure when I'm not quite sure what specifically she is referring to, like, does she mean how to look at it within her community, or?
I'm not sure.
Okay, I'm sorry. One of the things that Teresa talked about is that it's really hard to get good numbers related to mental health and well-being among the farmer population, because we don't really have good measures of that. If you're talking about generally thinking about people and whether they're doing well or not, whether they're mentally healthy, as opposed to specifically having a mental illness, which is kind of different, right? I mean, absence of illness doesn't mean that you're doing well. What we want to see for mental health is that people are happy and enthusiastic about their lives, and they're successful in their jobs and their relationships. So those are things that let you know that people are doing well. When you see that people are struggling in their day-to-day lives, that can be an indicator that mental health is suffering, if that's kind of what you're looking for. So I wasn't really sure what sort of, whether you were looking more at like where you get your statistics, or thinking more about people individually and how to sort of tell. So hopefully that answers the question.
Thank you so much, Heidi and Teresa. We surely appreciate you taking the time to speak with our audiences around the globe on mental health in agriculture. Please join us again next week, and we look forward to having you all here. And remember to share the information with your colleagues that you think can benefit from participation. Thank you, everyone.
Thanks for having us.